Hi, it's the nursing professor here. Today I want to talk to you about the new update on the 2026 guidelines for NCLEX. Some of you all probably have heard about it, but if you haven't, then know that this is going into effect on April 1st, 2026. For you all that have just completed your nursing degree and you're preparing for NCLEX, if you're taking an NCLEX prior to April of 2026, then you're going to still go with the 2025 guidelines. And this is for both registered nurses and practical nurses. All right, so the guidelines have been updated. I'm going to drop down the website below because all nursing students should be familiar with this. It is ncsbn.org, has a host of information that should be important to you. It even gives the latest NCLEX pass rates, and that's important for you, especially if you're a new student selecting a school, because you want to select a school that has decent NCLEX pass rates. Nobody wants an associate degree or a bachelor's degree in nursing and are unable to pass NCLEX. So you want to make sure that you're able to obtain all that information there. In particular, they have there's a free downloadable document. It's about 56 pages, and it goes through the details of the changes in NCLEX that you should really pay attention to. And the categories that they talk about, there are four. One is safe and effective care, which we've known that for years. They want to make sure that you're able to provide safe care. And they break that down into management of care and safety and infection control. Number two is health promotion. So that's all about prevention, primary, secondary, tertiary prevention. It's about educating your patient. It even has maternity in that section. Number three section is psychosocial integrity. That is all about advanced directives, end-of-life care, abuse and neglect, mandatory reporting, all those things. And number four is physiological integrity. And of course, that's all about all the med-surg things that you definitely should know. It also includes basic care and comfort, which you learned in fundamentals. So don't forget that all of the classes that you take in nursing are really equally important when it comes to NCLEX, because they're going to reach back to some of those basic skills that you learned in fundamentals. So just don't focus on med-surg, even though it is a large piece of the pie, but make sure you're incorporating all of the other classes as well, the pharmacology, the fundamentals, the mental health, because all of them will have a role in that show of NCLEX. All right, so I hope that helps. I am going to drop a link down below just in case that you don't have it. And again, I encourage you to take a look at it. If you're a recent grad, go with the guidelines for 2025, because this will not take effect until April 2026. All right, so I will see you next video. Bye for now.